For my next projection, I'm going to do the parietocanthal projection waters method of the facial orbits and nasal bone. For this projection, I'd want my patient to be in the prone or upright position facing the bucky. I'd want to center the MSP of the patient's body to the midline of the grid. I'd want to rest the head on the tip of the chin. Oops. And I'd want to form a 37-degree angle between the OML and the plane of the IR. So, like that. 37. I'd want my MML to be approximately perpendicular to the plane of the IR. So, like that. And I'd want my MSP to be perpendicular to the IR. Then you're going to center your IR to the level of the acanthion, so we're almost perfect there. And you'd center your CR to your IR. You would place your marker, have your CR entering and exiting the acanthion. And your collimation is going to be a 1/2 to 1 inch beyond the shadows of the lateral sides of the face, superiorly to include the supraorbital margins, and inferiorly to the level of the chin, but no larger than 8 by 10. And you would then instruct your patient to stop breathing, take exposure, and let them know that they can breathe. For my next projection, I'm going to do the modified parietocanthal projection modified waters method of the facial and nasal bones. And for this projection, you're going to have your patient roughly in the same positioning, except for you're going to have a 55-degree angle between the OML and the IR field. So, OML, 55. About like that. And then you would have, again, your acanthion centered to the IR. You would put your marker. You'd have your central ray lined up with your IR field. You'd have the same collimation as with the modified waters. And you'd tell your patient to stop breathing, take exposure, and let them know that they can breathe. For my next projection, I'm going to do the modified waters method again, but this one is for the orbits. For this, we're going to have, again, a 10 by 12 lengthwise IR. You want your IR to be centered to the level of the orbits, so about right there. And instead of a 55-degree angle for this one, we're going to have a 50-degree angle from the OML to the IR. So, OML, about a 50-degree angle. And you are going to have your central ray entering perpendicularly through the mid-orbits. You'd have your marker, and you'd instruct your patients to close their eyes and have them concentrate on holding still, take exposure, and let them relax. Okay. For my next projection, I'm going to do the PA axial Caldwell method of the orbits. For this one, I'm going to have my patient resting their forehead and nose on the IR. IR is going to be a 10 by 12 lengthwise field, and I'd want to center my IR 3/4 an inch distal to the nasion, so right about there. And I'd want my MSP and OML to be perpendicular to the plane of the ion. So, marker, MSP, OML. Okay. And I'd want my essential ray to be directed to the center of the orbits at a caudal angle of 30 degrees. So, like that. I'd place my marker. I'd collimate in on the sides. And I'd instruct my patient to close their eyes and concentrate on holding them still for the exposure, and expose and let them relax. For my next projection, I'm going to do the PA axial Caldwell method of the facial and nasal bones. For this projection, I'm going to have a 10 by 12 lengthwise IR. I want my patient in the prone or upright position facing the bucky. I want my MSP of the patient's body centered to the midline of the grid, and then I want their forehead and nose resting on the bucky. For this one, you want your neck flexed, so the OML is perpendicular, and your MSP is perpendicular, so check that OML. Okay, you want your MSP perpendicular, like I said, and you want to center the IR to the nasion, so they're about right there. And then you want your central ray to be directed at a caudal angle of 15 degrees to exit the nasion. So you'd center your IR and your CR and have them aligned with each other. Caudal angle of 15 degrees. You'd have your collimation about a ½ inch beyond the lateral sides of the face, superiorly to include the supraorbital margins, and inferiorly to the chin. I instruct my patient to stop breathing, take exposure, and let them know that they can breathe.